Let's go with the numbers first of all. There's about 28,000, give or take, COVID deaths in Michigan. That's total. However, of those, about 6,000 are from nursing homes. But according to a report that's going to be released on Monday, the exact number of people who died in nursing homes, according to the report, is actually 30% higher than what the state health department has reported. And all the fighting is just starting.
A 30% increase in deaths of a vulnerable population is certainly worth reevaluating.
The Mackinac Center Legal Foundation, on behalf of reporter Charlie LaDuff, sued the state health department last year and forced them to turn over numbers. They settled. Steve DeLee from the Mackinac Center says the question most people want to know is,
in these facilities that house the elderly in a common living situation, how many of them have passed away from COVID-19?
He said that deaths that occurred in smaller facilities with less than 13 beds were not counted, and those include adult foster care, homes for the aged, and skilled nursing facilities. If we include those smaller facilities, that the number would go about 30% higher?
I'd say at least that.
It's really the definition of what is a long-term facility. Is that accurate?
Well, it seems to be a lot of definitional fighting.
There's no thought about changing the definition of a long-term care facility?
No, our definition is accurate. Their definition is not.
State Health Director Elizabeth Hertel doubling down, basically saying that she complied with the federal and CDC guidelines in reporting nursing home deaths.
The CDC and CMS have very clear guidance for what constitutes a nursing home.
Shouldn't the state use a tracking system to get every death from every source possible? Wouldn't that be better?
That would be great. If we had the information technology infrastructure to do that, it would be a good thing, but we don't.
Should policy change?
Absolutely.
And the definition of a long-term care facility?
Representative Johnson created his own definition, and that's what they utilized.
Shameful what this department is trying to do.
Wow. Seems like Representative Steve Johnson, the head of the House Oversight Committee, is doubling down on the health director.
Of course we should include them when we're trying to figure out nursing home death. And for the department to try to excuse that, to deflect from that, to try to avoid accountability is shameful.
All right, there you had it. Representative Johnson said he's going to have the Auditor General, that's the author of the report, in his committee next week, and I'll bet that health director is not too far behind him. Taryn?
It sounds like even though when the official report comes out on Monday, this debate is only just begun. Now, in the end, though, what could we see change? You mentioned policies, but potentially laws, too. I know that Representative Johnson says he doesn't want this to happen again.
Yeah, probably no laws were broken here. It is a policy issue as to how you define long-term care facilities. Do you include those little ones, which according to the Auditor General, it's up at about 30%. I think the policy issues here, if we know exactly how many people died from nursing homes or how many people did die in nursing homes, then I think the policy would change. In other words, we may put more efforts and resources to nursing homes to keep those patients in there free from COVID than perhaps we're doing now. Again, that's a policy decision. Right now, we're looking at the numbers and how do you define these numbers, and that is what's getting everybody in a tiz. We're going to discuss more about that tonight.